In this video, I'm going to show you how to assess regional and segmental intervertebral motion of the upper cervical spine via the direct method in supine position.
Get our very own assessment ebook and mobile app. Links are in the video description.
Hi and welcome back to Physio Tutors. Passive assessment of the quantity and quality of segmental intervertebral motion, also known as motion palpation, is part of the diagnostic clinical expertise of manual practitioners to guide decisions on a therapeutic strategy for patients with spinal pain. Hypomobility indicates mobilizing interventions, while hypermobility calls for a stabilizing approach. A systematic review done by Van Tryffel et al. In the year 2005 evaluated the reliability of passive segmental assessment of the cervical spine and found an overall reliability of poor to fair. However, for segment C1, C2 and C2, C3, at least fair reliability was reached consistently. For this reason, we give this examination a moderate clinical value. In order to perform regional range of motion assessment for upper cervical spine flexion of vertebrae C0 till C3, have your patient lie in supine position. First, fixate the spinous process of C3 with a key grip into ventrocranial direction. Be aware that this is the other way around than in other parts of the spine due to the ligamentous connections of the upper cervical spine. Then your working hand is placed low on the patient's occiput and the patient's head is fixated between your working hand and shoulder. Now perform a maximal heteronymous 3D movement with equal components of flexion, contralateral, lateral flexion and ipsilateral rotation. The flexion becomes visible by tucking your patient's chin in. In this case, I am rotating the patient's head towards myself and I am performing lateral flexion away from me. An alternative is to perform this movement with my other hand and to laterally flex towards me and to rotate my patient's head away from me. Just pick a technique that better suits you. In order to perform regional range of motion assessment of upper cervical spine extension of vertebrae C0 till C3, have your patient lie in supine position. First, fixate the spinous process of C3 with a key grip into ventrocaudal direction. Then your working hand is placed high on the patient's occiput and the patient's head is fixated between your working hand and shoulder. Now perform a maximal heteronymous 3D movement with equal components of extension, contralateral, lateral flexion and ipsilateral rotation. The extension becomes visible by pushing my patient's chin forward. In this case, I'm rotating the patient's head away from myself and I'm performing lateral flexion towards me. Again, this can also be performed the other way around with your other hand. Both movements are judged on resistance during motion and at end range, range of motion, as well as possible pain provocation compared to the other side. For upper cervical spine assessment, be aware that a limitation at C2, C3 can influence movement of the higher segments. For this reason, C2, C3 has to be assessed first. Click on the info button in the top right corner in order to watch a video on how to assess this segment. A limitation of C0, C1 can limit movement of C1, C2. For this reason, we will start with the segmental assessment of C0, C1 first. To perform the direct segmental assessment method, first fixate your patient's spinous process C2 with a V-grip. Then place your working hand low on the patient's occiput and rotate to the contralateral side until you feel resistance. To assess movement at C0, C1, perform a lateral flexion movement towards yourself by moving your body sideways. The movement has to take place around a sagittal axis through the nose of your patient. For the assessment of C1, C2, keep your fixation and move your working hand down to the arch of C1. Your patient's head is in neutral position and no lateral flexion is present. Then, rotate maximally via your index finger on the contralateral arch of C1 and assess the end feel. Both movements are judged on resistance during motion and feel, as well as possible pain provocation compared to the other side. Alright, this was our video on intervertebral motion assessment of the upper cervical spine in supine position via the direct method. If you want to learn how to assess intervertebral motion of the upper cervical spine in supine position via the indirect method, click on the video right next to me. As always, thanks a lot for watching. Feel free to give this video a like and share it. If it was helpful to you, click on the subscribe button and the little bell icon next to it in order not to miss any future videos. This was Kai for Physio Tutors. I'll see you in the next video. Bye.